Because there are high costs that go along with this surgery, the number one thing I perform different than we do today, so to go back to their doctor so that the hospital gets paid, well, we're going to deny this. What is up, you guys? I'm Dr. Nick, and continuing with this series of videos that I'm doing to discuss the medical industry, today I'm going to discuss insurance companies' prior authorizations. I'm going to go through a quick story to do that so you can understand what exactly is happening when your medical office is doing a prior authorization and what it means and why we have to do them. So to do this example, I'm going to talk about the number one surgery that I perform in my practice, and that's bunion surgery. So if you're scheduled for bunion surgery with me, the first thing that we're going to have to do is get a prior authorization. And that just means we're going to have to contact the insurance company to make sure that they will approve your surgery so that the hospital gets paid and that our office gets paid. But more importantly, it's so that the hospital gets paid because there are high costs that go along with this surgery, such as operating room time, some of the supplies we use in the operating room, the equipment that we use to perform the bunion surgery can have high costs that go along with this, and the hospital won't allow the surgery to be performed or even scheduled without that prior authorization if it's required by your insurance company. So what happens is the insurance company will request the notes from our office. They review the notes to make sure that what is in those notes does deem necessary for the patient to have this surgery. So in this example, this patient came to me. She was in her 50s. She had had surgery done back in the 80s, and at that time the procedure was different than we do today, so it had a higher failure rate or a reoccurrence rate, so her bunions reoccurred. So she was coming to see me to have a revisional procedure for her bunions. So in my note I had discussed that the patient had previous surgery, I ordered x-rays, and there's certain things that the insurance company wants to see in the note. Conservative care has to be tried. It doesn't matter how bad the bunion is. They want to make sure that the patient first tried some conservative measures like wider shoes, orthotics, toe spacers, anti-inflammatories, ice, even physical therapy. If that's not mentioned in the note, the insurance company will deny the surgery and tell the patient that they have to go back to their doctor. We're not going to approve this, and I will have to implement these measures. So this patient had done all of that. I ordered x-rays. X-rays were done. And the insurance company also wants to see what the x-rays look like. Now, they don't actually look at the x-rays. They're going to review the report. So this is where the problem came in this recent visit that I had with this patient, and she was actually denied the prior authorization. When that happens, the insurance company will take a chance to go and talk to the doctor, and I have to actually schedule that through my office. We call that a peer-to-peer. So then what happens is we schedule a time that the doctor can meet with the insurance company and discuss the case. The person that we talk to at the insurance company is typically a doctor that's no longer practicing, or they're practicing part-time, and they're answering these questions. Now, every insurance company does the same thing. They typically will hire any doctor. It doesn't have to be the same specialty. In this case, I was talking to a general surgeon who no longer practices, and this particular surgeon was making the decision on whether or not my patient could have bunion surgery. So I reviewed the case with her, explained to her what the patient had tried, and when it came time to make the determining factor, the person that I was talking to, the surgeon that I just described to you, said, well, we're going to deny this because the x-rays aren't properly discussed or described. And I had discussed in the note and described what the patient's x-rays look like. And the insurance companies are specifically looking for angles. So we will measure the angle between your first metatarsal bone and your second metatarsal bone that shows the opening up of these bones, which produces the bunion deformity. We had documented those angles, documented the deformity that was present on the x-ray. The problem was the radiologist who read the x-rays only commented that x-rays were done 3 views that demonstrated prior bunion correction with healing noted. Didn't discuss the deformity that was present, didn't discuss the arthritis that was present. So this particular surgeon that I was talking to from a major popular insurance company denied the surgery on this patient because they didn't like how the radiologist read the x-ray report or read the x-rays in the report, even though I had read the x-rays, put them in my note, and discussed how severe this bunion was. So what happens next? The patient gets denied surgery. So they have to come back to my office. We have to do a rebuttal or some type of appeal process. What the insurance company wanted me to do was reach out to the radiologist and ask the radiologist to review these x-rays one more time and make an addendum. So that probably isn't going to happen on our end, but I actually reached out to the patient myself, discussed the problem with her, recommended that she call her insurance carrier and let them know what had happened, and hopefully we can reach a resolution on this. I'd love to hear some of your stories that you've had with insurance companies. Please drop it in the comment section below and maybe we can discuss it. If you have any questions or any stories that you want to hear where I can talk about the medical industry, I'd love to share them with you.